MDMA, what we're finding is that it serves as a catalyst for trauma therapy. What we're finding is that it facilitates a reduction of fear response, which can lead to more open communication about past trauma events without feeling overwhelmed. So in trauma therapy, one of the most challenging things that therapists face in trauma therapy is that when an individual is accessing previous trauma, they often go into a place of overwhelm or shut down. So we call that hyperarousal or hypoarousal. And so this really oftentimes impacts the ability for someone to process their trauma, because in order to process our trauma, the patient needs to be in a place of being able to be what we call in a window of tolerance. So being able to feel their emotions, have memories, but actually be able to be present with themselves enough to process and not just be in a state of dissociation or overwhelm. And so what we're finding with MDMA is that the participants that are in our trials are able to experience and express some of the emotions that are underlying and associated with their trauma. So grief and fear and anger, with less of a likelihood of being overwhelmed and overtaken by these emotions. MDMA, it seems, helps to provide an internal awareness and allow for there to be the painful feelings associated with trauma and for those feelings to arise, because those are actually an important part of the therapeutic process to be able to feel those often suppressed feelings, because in order to cope with PTSD, people often have to really distance themselves from their feelings in order just to get through day-to-day life. With that, the participants are able to communicate with the therapists with more ease. There can be increased empathy and compassion for themselves and others. And also it can help with the connection with the therapist too, because it really can allow them to feel a sense of trust and closeness with the therapist, which really helps with therapeutic alliance and rapport. And one of the things that's really challenging as a therapist is often you can work for many months or years just to be establishing a sense of safety with a client where they can actually trust. And so what we're learning about MDMA is that it can increase those feelings of connection and openness, and to allow the participant to access greater vulnerability to be able to process their trauma.